Hi, I'm Dr. Bekkum from All Seasons Full Body Chiropractic Center. I hope everybody's doing well out there. The big question that we have here today is, do you have chronic neck and upper back pain? I have a lot of patients come in lately here that have just upper back and neck pain. But the big problem is that a lot of their problem isn't just in their spine. A lot of their problems end up having to be literally in their shoulder blade and shoulder. So the big thing I guess I want to talk about here today is what is called scapulothoracic problems, or basically how your shoulder blade articulates with your spine as well as the collarbone. And this is where I'm having a lot of patients coming in that have had more chronic, upper back and neck problems. The issue hasn't been necessarily in their neck. It's literally been in the shoulder blade itself there. And most of it is having to deal with some weakness or deconditioning of some of the muscles, especially with people that have jobs where they're seated, they're using a mouse all day long or a keyboard. And it might have a little bit to do with poor ergonomics, but most of the time it's just that they've had this job for such a long time. It's not that it's an acute type condition, it's a chronic problem or a chronic, like I say, deconditioning of some of the muscles where, what some places would label an upper cross syndrome starts to happen. The head starts to poke forward. Let's see if I can kind of do this here. The head starts to poke forward, shoulders start to kind of round forward there. And they end up just stressing a lot of the muscles in that upper back and neck. If you're going in and you're getting your neck and your upper back adjusted all the time, and it seems like you're having to go back over and over and over again, and it's just not getting any better, it might not be that the problem is in your neck or in your upper back. We need to probably get it assessed a little bit further here and find out, actually, is it happening in the shoulder blade, shoulder, or even the upper rib cage itself? That's what I find that is missing with most chiropractic patients that come in, especially if they've been in another office and they just had to keep going back over and over and over again. There are some exercises that we can have people do. One of them is just literally a shoulder retraction type of an exercise. There's also some exercises for the neck. So like when I stood here before, and you kind of see how that neck pokes forward. Literally, we have people do reverse posture exercise, where we literally have them try to bring their head back and shift it back, go back as far as they possibly can. And by doing that, you can literally help to reverse and also helps to strengthen some of the muscles that are getting kind of chronically deconditioned. So that would be one exercise you can do there. The other exercise, we literally have people, they get their hands out here. Typically, I have them put their palms up. So let me see if I can get back far enough here. We can see palms up, and they're going to do like a pulling type exercise where they're going to pull their shoulder blades back and pinch their shoulder blades together and down just a little bit. This will help activate the bigger muscle that helps control their shoulder blade in their upper back, and that is your latissimus dorsi muscle, or what is known as your lats. Those help pull those shoulder blades back and in. That'll help stop some of that upper cross syndrome and help address some of the scapular and rib cage and collarbone type issues there. The other way we have them do it, they'll do it with their palms down. Now what you're going to do is you're going to keep your elbows up at shoulder height. I don't know if I'm going to bump into anything here, but you're going to pull straight back. Again, feeling that pinch in between the shoulder blades in the back there. You're going to feel like, there's hopefully, if you have any kind of muscle back there at all, like there is a pinch back there. If you don't feel anything activating back there, you're going to try and hold this until basically you feel the muscles kind of cramp up a little bit. Then I'm going to have you kind of let loose, kind of let them kind of relax a little bit there. Go back again. You're going to do this up to about 20 reps. If you can get up to 20 reps, then we're going to have you literally kind of move on to some other exercises there. You'll do a couple of sets of 20 reps there to help strengthen that there. If this is not helping you there, this is something where you can't do specific movements. Some specific movements you can kind of check just to see if it is your upper back or neck that's giving you some problems. This is what is called called a selective functional movement assessment. This is what I have some of my staff do in the office, and things that I'll check with you as well, just to make sure things are moving properly. You'll try and do these specific movements here. You can try them yourself at home, see if this is something that actually needs to be addressed. So what you'll do is you kind of hold your teeth together, and then you're going to try and tuck your chin down to your chest. So you'll see if you can get your chin down to your chest at all there. And then you'll tip your head backwards. Let's see if there's any pain or discomfort at all with that. The other thing you're going to do, again, keeping your teeth together there, you're going to turn to your right as far as you can and see if you can kind of tuck your chin down to your collarbone. And do the same thing to the left and tuck your chin down to your collarbone. If you can do that, everything is really, probably working really well in your neck. So the problem might not necessarily be in your neck then. The next thing you're going to want to do is take your arms, you're going to cross them here, and then you're going to try and twist as far as you can. Again, you're going to watch for pain, and you're going to watch for, hey, are the muscles feeling like they're cramping up or getting uncomfortable? You should be able to turn at least 45 degrees, and then you're going to go the opposite direction. Turn. And again, you should get to about 45 degrees. You shouldn't feel like there's any muscles cramping up or anything like that. If that's looking pretty good, it might not even be your thoracic spine then. So there's some other checks. So you can take your one hand, set your hand on top of the opposite collarbone, see if there's any pain or discomfort with that. If there is, there might be some problems with right here. Try to get my finger up here. With your AC joint right there. If there is, actually I shouldn't say that, it's actually on the opposite side over here. So it'd be probably with your AC joint over here. And you lift your arm up and see if that causes any further discomfort. If that all checks out fine, it's not the acromioclavicular joint, or AC joint as it's called. You can do the same thing on the opposite side there. Then it's not that at all. The next thing you want to do, I'm going to turn around here, so I don't know if you're going to be able to hear me as well or not. You're going to try and turn around, and you're going to try and take your hand and reach over and try and touch the opposite shoulder blade there. Do the same thing on the other side. If those are restricted, that's going to be your shoulder blade there. The other thing you want to do, I don't know if I can do it myself, because I think my shoulders are kind of tight, is try and reach the bottom of the shoulder blade. Like in my case here, I can't quite reach the bottom tip of that shoulder blade there. Other side there, this one's even more restricted. So I need to have my shoulders looked at here myself, just to help get the shoulders moving properly and the shoulder blade. So those are some quick things you can tend to do yourself there, just to check and see if there is a problem. Gave you a few of the exercises there as well. So any questions?
One of the things that I was wondering, you talk about shoulders, and I know as I've seen a lot of chiropractors in the past, and the one thing that happened for me for the first time ever when being adjusted by you is that you actually adjusted my shoulders. What is the benefit to that for people who are having neck pain or probably sitting at a desk a lot? Why is that an important thing to be adjusting?
Well, again, that's why we're looking at your full body here. We're trying to get your whole body aligned back where it should be at there, so that just like your car, if you have an accident or something like that, you can get your spine adjusted and your spine might be perfectly fine. And I do find that with a lot of people here, that their spine is really fine, especially if they've been to another office. They've probably done a fantastic job adjusting their spine. But if you're still having that neck and upper back pain, then yes, we need to look at it might be the shoulder blade that we need to get adjusted and get that back in alignment. A lot of people will have even some audibles. You'll hear it kind of pop and release. The testing that we do here, we can go back and retest it as far as making sure that that functional movement is back there. Also testing the strength to make sure that the muscles, if we did test them beforehand, if they were weak, if it's a musculoskeletal problem, almost 100% of the people will have almost 100% of that strength back after we get it treated here. It's just a matter of if you're going back to your normal daily activities, you might literally then see that ergonomically, your desk might not be set up the way it is or should be there, and then that's just stressing yourself again. A mouse is okay. There's different types of mice that you can use on your computer that would be more ergonomically correct. So it's not going to throw that shoulder blade out there. Occasionally people do get that acromioclavicular joint or sternoclavicular joint. So here's the SC joint would be right in here. And then the AC joint you're going to be looking at on that side would be right out here. So we might need to be dealing with those as well. So again, we're looking at getting everything moving correctly again. So not only do we get the proper alignment, we get the proper range of motion, get the proper muscle strength, and the proper function back. Once we've gotten that back for you, then hey, everything should be doing good here. And most other chiropractic offices are not looking at that. They get done with the spine and they're done. So they're hoping that everything else gets cleared up just because they've dealt with more of the neurological component of everything there. So
you talk about ergonomics a lot, and the people who are sitting at the desk and using a mouse. What are some things that you notice when you're going into people's offices and looking at where they're sitting? Is there something that you're seeing a lot of that may be causing neck or back problems? Is it that their screen's too high, their chair's too low? Is there something that they should specifically be looking for if they're having neck and back pain?
There could be a host of issues there. I mean, all the ones that you just kind of mentioned there. I mean, it could be that they have their mouse just a little bit too far away, from where their center of their body is. They get it out too far away from their body, so then they're stressing their shoulder more. That even stresses some of the rotator cuff muscles. So, if we don't have that shoulder blade and the collarbone lined up where it should be at, office workers are going to start to notice issues where they're going to stress and strain the rotator cuff muscles. Now you get into sports, baseball and stuff like that, where there's a throwing motion. If your shoulder blade's off and the collarbone's off, you don't have a stable base for the rotator cuff muscles to work off of then. Everything's a little bit looser there. So it's going to be much easier for them to go and aggravate the rotator cuff muscles and, start to have problems there. And then they start to get fascial trigger points and you start to have pain all over the place. That's where we're trying to narrow everything down, get into what's causing the problem and deal with the cause rather than chase the pain. Because if we're just chasing the pain around, it's like a dog chasing his tail. You might find the problem every once in a while. He's going to bite his tail and it's going to hurt, but it's not really fixing any problems here. We want to get down and find out, exactly, is it that shoulder blade that's causing the problem? Is it the AC joint? Is it the SC joint? Is it the glenohumeral joint itself? Where the bone from the upper arm comes in and then attaches onto the shoulder blade. So all of that needs to be addressed, to make sure they have the proper mechanics. And there's lots of muscles around there too that need to be tested to make sure that you have the proper strength there. So not only are they keeping that joint stable, but then, hey, do we need to get those built up so that, again, it's not keeping it stable and building on it so that long term you're just not having any issues there. So we're doing a little bit of, if it's not rehab, it's some prehab with some people here to make sure that those joints are built up properly and you don't have the chance of even injuring them. So other things you can kind of do at home. I mean, if you do have some of those aches and pains and all that sort of stuff, obviously you can use some of the acronyms like PRICE, protect, rest it, ice it, if it's an acute injury, if it's within anywhere from 24 to 72 hours. So with that first day to 3 days there, you're going to want to probably use some ice on it to keep the inflammation under control. Heat and ice are going to do virtually the same thing. The big issue that you're going to have with ice is that the ice is going to make the muscles a little bit tighter. Anytime when anybody gets cold, what do? All the muscles kind of tense up. So the problem that you're going to end up having there is you're going to be a little bit stiff from having the ice on. So usually after you have the ice on, you want to try and move the part that's affected, through a normal range of motion, normal pain-free range of motion, just so you're not injuring the area there. Once you have gotten past that third day, now you can start to introduce some heat or you can do some contrast. But if you're going to do the contrast, you always want to start and stop with ice. So it's going to be ice for about 15 minutes, heat for 15 minutes, ice, heat, ice, whatever pattern you want to be at there. Typically, it's about 3 sessions of ice and a couple of sessions of heat. If you're really in an acute situation, you're an athlete, you just got injured, you sprained your ankle, the big thing that they'll do with contrast there, it's actually you're going to put your foot in a bucket of ice. First of all, you're going to go through that same range when you put anything in ice, in a bucket of ice. It's going to start to feel obviously cold, then it's going to feel like it's burning, then it'll feel like it's achy, and then it'll feel like it's numb. Once it's numb for about a minute, then you're going to start doing a contrast where you're going to move that part from that ice cold water to not hot water, but room temperature water. You don't want to shock it. That'd be too much for anybody's system there. So they go from that room temperature water for a minute, back into the ice for a minute, and go back and forth as long as you can kind of tolerate it there. And what you're going to find is that you're going to get some good pumping effect of getting that blood in and out of that area there where if you're at a tournament or something like that, something happened on the first day and you need to be able to play that next day, you might be able to play that next day just because now you've gotten that pumping effect there with getting that blood in and out of there. You're probably still going to have to tape that area up to support it so you don't continue to injure it further there. But it might be a case where, hey, now you're going to be able to play, whereas if you didn't do anything like that, you might not be able to play. So hope you found that information interesting and helpful. If you have any further questions, you can fill them in the comments here. If we don't get them here today, we will answer those and get the information out to you later. Have a great day, and we'll see you next week at 11:30.